Have you ever experienced an unexplained ache or noticed a bump somewhere on your body, and your mind immediately jumps to worst-case scenarios? It is completely natural to feel a jolt of concern when something unexpected appears, especially when it involves your bones. But here is some reassuring news. Not every bone growth or abnormality signals a serious problem. Identifying a benign bone tumor is a careful process that medical professionals undertake by combining several key diagnostic tools and expert analysis. The core goal is to distinguish non-cancerous growths from malignant ones, primarily through detailed imaging studies and, sometimes, by examining tissue samples. It is a multi-step approach designed to provide a clear and accurate picture of what is happening inside your body. The fundamental reason a bone tumor is classified as benign is due to its non-aggressive nature. Unlike cancerous tumors, benign ones do not spread to other parts of the body, a process known as metastasis. Instead, they typically grow slowly and stay contained within their original location. Radiologists and pathologists look for specific hallmarks. On an X-ray or MRI, benign lesions often have clear, well-defined borders and may show a thick, reactive bone rim around them, which is called a sclerotic margin. This indicates the body has had time to wall off the growth. They also tend to have a uniform appearance without signs of chaotic or rapid growth. The type of tissue inside the tumor, known as its matrix, can also offer clues, like calcified or fatty patterns that are characteristic of benign conditions. So, how does a doctor actually go about determining if a bone tumor is benign? The journey usually begins with a thorough medical history and a physical examination. If a bone abnormality is suspected, the first step is often an X-ray. This common imaging technique provides initial views of the bone structure. Depending on what the X-ray reveals, your doctor might then order more advanced imaging, such as a magnetic resonance imaging, or MRI scan, or a computed tomography or CT scan. These offer much more detailed cross-sectional images, helping to visualize the tumor size, exact location, and relationship to surrounding tissues. In some cases, if the imaging is not conclusive, a biopsy may be performed. This involves taking a small sample of the tissue for microscopic examination by a pathologist, who can then definitively confirm if the cells are benign. A fascinating aspect of benign bone tumors is that some are considered leave-me-alone lesions. This means that if they are not causing symptoms and imaging confirms their benign nature with high confidence, no treatment beyond monitoring may be needed. For instance, an osteochondroma, a common benign growth, can often be simply observed. This careful diagnostic work ensures that you are not undergoing unnecessary treatments while still ensuring any potentially problematic growth is properly identified and managed. Ultimately, the process of identifying a benign bone tumor is about bringing clarity and peace of mind. By methodically using imaging and, when necessary, tissue analysis, medical experts can confidently differentiate these non-threatening growths from more serious conditions. This thorough approach allows for precise diagnosis and ensures that any necessary management is tailored specifically to your individual situation, helping you understand your bone health with confidence.